Hi, I'm Dr. Rob Riley. I'm a family physician here at Memorial Hospital. I was asked to talk to you today about the flu. It's starting into February now, and influenza is a virus that we commonly see people getting ill with at this time of year. The symptoms are usually headache, fever, cough. A lot of times people wonder, how do you tell the difference between a flu and a cold? And actually, early on, the symptoms can be very similar. The difference is when we have a lot of flu in the community, like we do now, the odds are obviously more likely that this would be influenza than a cold. So that has some impact as physicians as to how we decide. Also, though, oftentimes the symptoms of the influenza virus are somewhat more severe. People with cold may just have mild achiness, runny nose, things like that, whereas people with influenza tend to be a little sicker. They may have higher fevers, they may have more cough, they may feel like they got run over by a truck, is a common story we hear this time of year with people who end up having influenza. So what do you do about these things? The good news is most of the time, influenza is what we call a self-limited illness, which means your body's immune system is perfectly capable of taking care of this all by itself. You don't have to take medications or anything else. Simple things, your mother's advice is good. Get plenty of rest, drink plenty of fluids, a little chicken soup, and a little thyme, oftentimes is all most people need. We do get worried this time of year, though, about influenza because some patients are more susceptible to some of the complications. And the one we worry about most often is that sometimes people can get a pneumonia after having influenza. It's like the influenza sort of sets up the lung to be more easily infected by bacteria. And we particularly worry about this in people who have altered immune systems and older people and pregnant women. So if you're in any of those categories and you begin to get these sort of symptoms, seeking out a physician's help earlier rather than later is probably a good idea. Well, what do we do? Well, we do have some options available. If we can catch this within the first 24 to 48 hours, there are some medications which have been shown to somewhat shorten the duration of the illness, and we hope in some cases in people who are at higher risk, prevent them from getting some of those most serious complications. Most people don't need to take these medications, and they're not as effective as we'd like, frankly. We would wish that they could be like penicillin is for a sore throat, but they are not quite as effective than that, but they may shorten the illness and may reduce the complications. I think the most important message, though, about influenza in our community this time of year is prevention is better than treating the illness after the fact. Even though we're several months into the time when we've been giving influenza vaccines, it's not too late to do that, even in the middle of an outbreak. We know that it will take a couple of weeks for someone to muster the full response from the immunization, but we may have influenza in our community for a couple of months. So it's not too late to get those vaccinations if you haven't done that yet. That's the most important thing to do to stay healthy.